We listened together to the practice of applied behavior analysis and the utilization of applied behavior analysis, the private sector and the private centers. We have discussed and elaborated the problems that we have and the challenge. We're going to be discussing the utilization of applied behavior analysis in the medical field or hospitals or clinics, where we are going to invite Dr. Eman Abushabab to the stage. Dr. Eman is a board certified behavior analyst and a qualified behavior analyst as well. She is licensed from the Community Development Authority, and she is also a master's degree holder in applied behavior analysis practice. She's passionate and she's utilizing the principles of applied behavior analysis to make a meaningful change with her clients. And she is specialized in developing and implementing behavioral interventions. Through her career, she worked with multiple and diverse population, including children with autism and also developmental disabilities and behavioral health issues. And I'm honored and I'm happy to have Iman with us today. Iman, the stage is all yours.
How is everyone doing? Good? Ready? Have you ever heard about a BCBA practicing in the medical field? Please raise your hand if you do. Oh, nice. Okay. Today we're going to talk about implementing ABA in hospital setting. So we're going to view together how this is basically happening in the UAE. We are going to discuss together. We're going to discuss about ABA in healthcare in general. So we're going to have an overview and what's the link between healthcare industry and ABA. And then we're going to dig deep inside into the hospital setting, and we'll see an actual example, a case study of medical hospital, Medcare Hospital, as an example of applying ABA practices into their sphere. And then finally, we're going to talk about a future of ABA in the healthcare industry, mainly in hospital settings. A little bit about me. I'm a board-certified behavior analyst, and also I have my bachelor in public health. So the start was in public health, mainly in mental health, but then down the road, I chose to be a behavior analyst, and enough about me, I think. Okay, so we've already said about this question. I think 2 people only raised their hand, just to know someone actually in the field working in actual hospital setting. And that's gonna give us an indication that it's very rare. Let's see how the whole thing started with ABA and in healthcare industry. As we all know, ABA is a science. It's not just, a treatment for individuals with autism. ABA started with, just a change, having a meaningful change, socially significant behaviors. That's what we focus on. And believe it or not, ABA started with healthcare industry. Back in the 1960s, when they started to know more about ABA, it all started with actually healthcare industry. Mainly when we're talking about outpatient, healthcare sector, hospital setting, that's the start of ABA. But there is one thing happened in the late 1990s that changed the whole perspective about ABA industry. Can you guess what happened? Autism. Autism spread all over. Now, behavior analysts start working a lot towards, how we can step in, how we can help individuals with autism. And that's how we get the link between ABA and autism. And mostly if you ask people now, what does it mean ABA to you? They will link it immediately to autism. So this is how a little bit background of ABA in healthcare. So again, ABA is not just a treatment for individuals with autism. It's more than this. It's a science that is helpful to change and bring a meaningful change into many more settings. So if we are exploring now the settings in the UAE, I'm speaking specifically in the UAE, we've seen previously with Dr. Lama, she spoke about mainly in center clinic-based, and then we're gonna have also another presentation about school. We will see also community-based, home-based. And finally, it's the new addition, which is the hospital setup. Now, before I go to the case study for today, I wanna make a clear kind of differentiation between what do we mean by a hospital setting versus a clinic setting. So you might hear people say, I work in a clinic in the UAE as a behavior analyst, but how this is really different from a behavior analyst working in a hospital setting. So I gathered 4 main kind of areas. The first one is the environment. So when we're talking about center-based or clinic-based, we're talking about more intensive, more kind of a structured way of doing ABA. So this is how is the norm. But with the hospital setup, it's more of dynamic, more of complex. You cannot, just have one way of doing things. You might have different programs based on different needs, and that's really big challenge. For example, if a person working as a behavior analyst working in a hospital setup and have, for example, an individual with OCD or an anxiety along the way with the autism, let's say, what they're gonna do, how they're gonna interact with that individual, or not even individual with autism, different kind of diagnosis. So this kind of dynamic that we're talking about, and that's lead us to the second point, which is the population that we're serving. In clinical setting, mainly they focus on 1 or 2 population. We see mostly centers with autism, they're dealing with it. But with the hospital setup, it's more than this. It's wider perspective of mental health issues. Sometimes they just have behavioral issues. A stubborn boy that parents cannot deal with and they need like a behavior intervention. But that boy, because of his behavior, cannot do much in his life. So he needs immediate intervention. Collaboration with other professionals. With center-based, you will find behavior analysts working with other supervisors, maybe aligned health like speech, OT, like occupational therapy, speech, and maybe also a clinical psychologist. This is how it goes with educators as well, parents. This is how the environment surrounding. However, with the hospital setup, you will see that a board-certified behavior analyst is not just at the top right there supervising everyone. A board-certified behavior analyst is one of the whole cycle, and I will show you in a bit how this is going with the hospital setup as an example. And the intervention focus, and we're talking about a clinical setting, the intervention focused mainly with comprehensive approach. They focus on maybe individualized behavior plan and so on. With hospital setting, crisis behavior management comes down the road. How to train staff as well is coming. So it's a wider perspective. And there are sometimes immediate needs for trainings for either the staff, patients, and so on. So you see now how the dynamic is going and the differentiation between clinic setting versus hospital setting. And now it's the case study of how hospital setting is happening actually in the UAE. I do believe that this is the first of its kind joint venture between Medcare Hospital and Kamali Clinic. So what happens with Medcare Hospital? They saw the need of having a very comprehensive approach, gathering everyone in the field under one roof to treat medical, mental issues. And there was none. And they didn't even have the expertise, the capacity to do so. So they actually had a joint venture with Kamali Clinic. This is a top-rated clinic for mental health. And say, hey, let's do a joint venture. Let's gather our efforts. And then we're going to have something very unique. And that's how the Medcare Kamali Clinic came on the way. If you want more information, I left the link below so you can have more information about this joint venture. As you can see here, That's what I meant by a behavior analyst is one part. It's not no more the supervisor, have so many RBTs supervising and so on. No, it's more than this. We have psychiatrists. Psychiatrists, either they have expertise with adults, children, variety of mental health issues, each and every one in their domain, both in Arabic and in English language. Also, we do have the neuropsychology department, and I do believe Dr. Alexander is one of the only 3 people in the UAE licensed by a DHA to do certain assessments as well related to the neuropsychology. And we have psychologists, clinical psychologists ranging in their expertise as well, and aligned clinicians, a dietitian, clinical dietitian, occupational therapist, speech, and behavior analyst. So this is the dynamic of this kind of group and the team, basically. So what do we mean by this support system? What does it mean for a behavior analyst to work in this dynamic? How this is helpful for us? Basically, it's a clinical focus. All what I need to care about as a behavior analyst is to do the clinical work. No more pain of scheduling. For behavior analysts, they know the pain of scheduling, administrative work. I don't have to do any of these. We do have a hospital system that takes care of booking appointments, rescheduling, payment, anything related to admin. That's all what they do. And then also it's a hospital system. It means that with one click, I can see my patient's history, background. I can see whom they saw from different professionals, not only the professionals that you saw, but also maybe a pediatricianist, maybe they do X-ray, they've done hearing test. I can access it all. And then also other people can access my session notes as well, or any kind of consultation outcomes, they can read it. So you feel it's a very comprehensive one unit altogether for the benefit of the patients. And then we do have also a weekly MDT meeting. All the people that you saw in the previous slide, they meet all together once a week to discuss patient cases. For me, as a behavior analyst, it was a very eye-opening for me because I'm no longer just dealing with individuals with autism. I saw, for example, certain cases. I saw the misdiagnosis that happened. And I remember one case specifically that I worked with, a patient who came 5 years old. All his life, parents thought that he has autism. But after a careful diagnostic tools, it came out that he had ear infection, affected his developmental delay, and voila, they're treating him as individual with autism. So this is really, really an eye-opening to us all, like kind of bridging the gap between diagnosis and treatment. And I've always looked at myself as a BCBA like in one bubble, like having behavior treatments, IEPs, preparing this and that, but I've never had the chance to talk actually to people who made the diagnosis. And then finally is the training and supervision. As you can see, it requires a lot of training and intensive, actually, continuing of education. For example, I had to learn more about acceptance commitment therapy because it was suitable for some of the cases that I had. And it's a big and a huge responsibility because none of the education or the supervision equipped us to be in such setting. So we've seen how this kind of field or the healthcare industry is helpful for behavior analysts and what does it mean to be there. But what we can add to this field, what we can add to the behavior or the healthcare industry, we can add a lot. First of all, as I have mentioned, we can bridge the gap between the diagnosis and the treatment. Lots of time we had meetings where I had to put my insights as a behavior analyst and have the treatment plan and goals for certain patients just to kind of indicate what we can do next after the diagnosis. So I feel like this is really, really good thing, what comes after the diagnosis. So our part is right there. Also, we can monitor medication effectiveness. There are certain cases that I worked with the psychiatrist that they say, hey, Iman, I want to check how the effectiveness of this medication is coming with this patient. Can you help out with this? Yes, we're good at data. We're good at numbers. We are good at tracking the change. So that's what we're good at. So we can function this in the healthcare industry of monitoring such changes and give kind of reports of saying, yeah, this medication is really good, side effects is 1, 2, 3, or no, this medication is not working. And finally, behavior management. I had to put, for example, training programs to just have behavior management techniques for staff or for a specialist as well working in the hospital. Is there many more? Yes, but step at the time because we're just starting it. And I do believe in the future indication, we can do much more in the healthcare industry. Despite all these kind of good sides, there are definitely challenges. And here we'll talk about with pure honesty with challenges that I personally faced when dealing with the healthcare industry. Number one is insurance. I felt kind of sad when I see certain domains, like let's say occupational therapy or a speech therapist who have their hours covered under insurance. So the patients can access this kind of service for insurance. However, when it comes to ABA, nope, that's not kind of a solution. So everything that is happening in the hospital right now, ABA is not covered, unfortunately. However, this is our way now to fight for health insurance companies to say, we have ABA kind of service. We do have the ABA industry that you can actually have available hours of this kind of treatment. If we became away from healthcare, then how we can fight for the healthcare insurance companies and say, hey, this is a right for the patients. Why not? This is not covered in insurance. And hopefully, as Dr. Lama said, now with the new initiative in the Department of Health in Abu Dhabi, there is the new guideline that saying ABA now is actually a way to go when dealing with individuals with autism. So hopefully, there are going to be changes regarding the insurance. And then supervision in ABA, as I have mentioned, if anyone wants to have a career in healthcare industry and want to be there in one of the hospitals, how many supervisors can do this? So also this is a shift in mentality of saying what we can offer in supervision, what we can cover in our supervision as well, curriculums that we are training arising BCBAs. And I think this is one of the areas that we need to shed the lights on. And research, definitely. As we have mentioned, late in the 90s, all the research has been implemented with individuals with autism. Recently, we've seen a new criteria with the BACB board. It's called the clinical, basically a behavior analyst. So they now put more of a clinical emphasis on healthcare industry and kind of research towards it. And finally is the advanced coursework. With coursework, if you want to see and you advance your knowledge about healthcare and ABA, what we can find out there. Super limited. I had to have a course about crisis management from non-ABA perspective. So I can link how ABA perspective is coming down the road. So also this is advanced coursework either in universities or trainings. This is also something we need to have an eye on. And we need to build a collaborative future, definitely. Building collaborative future comes in many aspects, not only in the mental health. So now currently the practice in hospitals mainly with mental health, but we can do much more. For example, the patient compliance and engagement. And I cannot wait for Mr. Mus'ab's presentation when he will talk about organizational behavior management, because this is also organizational behavior management in healthcare specifically. And then crisis intervention. The crisis intervention also is something required. And I know some of the BCBAs already working with certain trainings, right, Dr. Lama, with hospitals basically, to just give them more of a crisis intervention, having the behavioral strategies of avoiding any kind of escalation of behavior, especially when they are dealing with emergency rooms or certain behavioral issues that is super intensive in the hospitals. And finally is the pediatric care. And also it was mentioned in the previous presentation how pediatricians want this. They want ABA actually to be present. They want the guidelines. They want to have people who are experts just right beside them to say, okay, we can help in this kind of behavior. So I see also a great opportunities to have ABA in pediatric units as well. The conclusion, basically, just to summarize everything, ABA is a scientific approach. ABA is not just for individuals with autism. The start of ABA was really great when we had multiple settings talking about clinical outpatients. We had hospital setting. We had all the settings. But the shift in the mentality of behavior analysts to work with individuals with autism and the shift of research led us to be super limited. And we want to create this kind of change. We want to have different approaches, different practices of behavior analysts working in multiple settings. And P.F. Skinner, I want to have this quote for him. It's not a question of starting. The start has been made. It's a question of what's to be done from now on. And these are my references. And thank you so much.
Hi.
Hello.
How we can apply for those training you were talking about?
That's a very interesting question. So I had to have, for example, for myself from international providers. Here in the UAE, I don't think we have any of courses that is basically targeted with healthcare industry. But I can maybe share we can talk together and I can share with you some resources afterwards. Yes.
You know, the other day I was talking with Dr. Hakam from Al Jalila Hospital, who's heading the diagnosis team in the hospital over there, and he was saying, he shared with me a file issued from Dubai Health Authority, and it's basically the guidelines of autism and what should be done exactly, and it does specify extensively applied behavior analysis as, you know, the go-to therapy, yet it's not covered in insurance. It made me just wonder if there is something from our end as professionals that we should be doing and we're missing. I don't know, I just thought of asking you, I mean, you've been working in a hospital also, you must have got the experience of working in a hospital and how things are working over there. So what do you think about that? Like when the authority is saying it's applied behavior analysis, but on the practice, it's not covered in insurance.
Yeah. Okay, so when I heard about this for the first time, I was shocked. So psychiatrists, when they want to have like kind of the coverage of insurance, if they put the diagnosis of autism, it will not be covered. Even for psychiatrists, clinical psychologists, name it and have it. Because the insurance company says, okay, autism is what? Is a lifelong condition. How we can cover this actually in the insurance? How you can request us to do this? It's a lifelong. So we cannot accept. Always, insurance companies, they don't want to do the coverage, right? Let's be realistic. So what's happening here is, okay, what the psychiatrists say, but this person is having an anxiety. An anxiety is a treatable. This person is having 1, 2, 3, for example, stuttering for speech. Okay, it's a treatable. Then and only then they issue the coverage.
Makes sense.
I just wanted to thank you first for actually giving us such an informative presentation. I was actually curious because I wasn't sure if hospitals are actually included in this. I'm not an ABA. I'm actually one of the parents of, and my son goes to Sanad, and he's a 4-year-old. And coincidentally, I'm actually in the process of starting a diagnosis process for my child. And I did not want to wait any longer because I didn't know the right route. And I'm always in speaking terms with Mr. Mahmoud, and he kind of, guides me and tells me how it works and what's to be done in order for me to get the right diagnosis. But insurance has been actually the biggest drawback in our case as well. And not gonna lie, someone who's an expat, someone who's not a UAE, passport holder, I feel like, just like Dr. Lama also mentioned that the majority of the population in the UAE, or let's just speak for Dubai since we're here, is more expats than the rest. And we ourselves, without any shame, are struggling, to keep up with the rents and the fees and everything. And especially in a case where I have only one child and we're still in the process of the diagnosis, but at the same time, we have only one bread earner, and I'm choosing to give up everything because I want to be able to provide for my child as a complete caregiver.
Yeah.
So the question then just comes back to, how long do we have to wait for this? Again, I'm not pointing it out that you're going to, I hope and pray that inshallah someday you're actually that person who gives us that solution to the insurance, but how long is the waiting? A, how long is the waiting going to be? And B, I really appreciate that Mr. Mahmoud actually asked the fact that he actually wants to be able to be a part of this, and he wants to ask if they as professionals can actually make a difference, So I feel like being in that stage where you have actually discussed that we're struggling, how long is the waiting and what are we really supposed to do, especially because we're expats? And
Yeah.
I also think for those that, yes, we're struggling and doing whatever we can, but what about the people who actually have, children and they can't even consider this as an option? They're just sitting there watching their children be miserable and
Yeah.
not being able to do anything because they don't have insurance.
Yeah. First of all, I hear you. I understand you very well. And
you.
to answer your question, I don't have an answer. And I know that you know that I don't have an answer.
I know.
However, if we gather our efforts as professionals, parents, and if we just do a kind of proposal, and I know it's coming down the road because as we have mentioned, the Department of Health now having applied behavior analysis linked with autism spectrum disorder. So there are really high hopes with this, definitely.
Right. The initiative in Abu Dhabi,
Yes.
and I know also in Dubai, there are some work in progress as well. And I'm hoping that at some point we'll get that through. But it was important also to remember, all of us, that still applied behavior analysis is relatively new,
Yeah.
right, to the entire world. And even though that UAE has, came before everyone in the field, and implemented applied behavior analysis before all the other Arabic countries, but still it's relatively new. And it is happening slowly but surely, inshallah. I think, when we get together like this, having great speakers from, the best places in the country. We have Kamali and Medcare, we have New England Center, we have Sanad Village, we have also the rest of our beloved speakers. This is, like one step along the way to get together, organize something, and in the future, I hope that this is going to be bigger and bigger and bigger, and we can showcase in the right way And based on that, we can make the right change or support to make the right choice or a better choice and decisions. This is what I'm thinking.
100%.
Right?
Yeah.
Thank you so much, Dr. Eman. It was a pleasure hearing you. We started talking about applied behavior analysis in private centers and how ABA is being utilized, and then we moved to hospitals, and we got a great insight about how it is being done over there. I love the idea of focusing on the clinical work and not focusing on the other things, because that takes a lot of our effort and our thinking when you're trying to do administrative work. I do believe also that all of us being supervisors by nature, that comes with a lot of organizational behavior management strategies that we have to implement by default. I'm thinking also that we are going to still talk about organizational behavior management as well in Saudi Arabia and see how it goes over there.